of the Global Environmental Sustainability Engagement at Johnson & Johnson, was initially going to join us to give welcoming remarks and introduce our new cohort of Climate Health and Equity Fellows. She is quite sick today with flu and can't join us after all. And since she can't, I'm going to hand this off to our State Affairs Director, Dr. Mark Mitchell, to introduce the effort and take it from here.
So thanks so much, Lisa, and thanks for folks for being here. The Climate and Health Equity Fellowship Program, which we call the CHEF program, was launched in 2021 in partnership with the National Medical Association. This was done in recognition of the fact that climate change is both a health emergency and a major health equity issue. We recognize that throughout the United States, there's a need for more diversity in climate and health leadership, and a sharper focus on equitable climate solutions. The goal of the fellowship is to empower doctors of color from populations that face greater harms from climate effects and are underrepresented in medicine to become leaders in climate and health equity, education, advocacy, and policy solutions. This year, we've been able to expand our fellowship class from 16 fellows to, from 6 fellows to 15 fellows with the generous support of Johnson & Johnson, along with additional support from the Energy Foundation and the American College of Physicians. We've also increased the diversity of our fellows from other racial and ethnic groups that are underrepresented in medicine. In collaboration with the National Medical Association, the National Hispanic Medical Association, the GLMA health professionals who are advancing LGBT equality, and the National Council of Asian Pacific Islander Physicians. By providing training and hands-on experience to members of these societies, we hope to help expand the diversity of climate and health equity leadership within these medical societies. On the following slides, I'd like to introduce you to some of our impressive 2022 class of CHEF Fellows. Please take a moment to appreciate the diverse specialties represented across the country. Next slide. We don't have the slides for our new fellows. Okay, so yes, so here's our class of 2022. Dr. Jerry Kennan Smith, Dr. Jessica Edwards, next slide. Dr. Tracy Henry, Dr. Jessica Isom, next slide. Dr. Torrance Barry Nicholson, Dr. Dorothy Russ, next slide. Dr. Frank Samante, Dr. Renee Settle Robinson, next slide. Dr. Yvonne Collins, Dr. Ricardo Carrera, next slide. Dr. Rhonda Lane, Dr. Nicole Loom, next slide. Dr. Nanoma Ojiaku and Dr. Prega Rai. Next slide. Dr. Jesus Salcedo. So this is our class of 2022. And this year's class will be divided into an Eastern and a Western cohort. The Western cohort would be led by Dr. Venice Curry, our Fellowship Associate Director. Dr. Curry, please turn on your camera and wave. And she's being assisted by Associate Program Manager Jordan Carter. Now I'll turn over the remainder of our presentation to Dr. Kimberly Williams, our Fellowship Program Manager. She'll moderate the presentations of the capstone projects from our 2021 Climate and Health Equity Fellowship graduates. Dr. Williams.
Thank you so much, Mark, and hello, everyone. It has truly been a privilege working with Mark and the consortium team to build the Climate and Health Equity Fellowship. I am most honored to have spent the past year watching the learning and the growth from our 6 fellows. I will introduce you to them and allow them to share more about their efforts in climate change and health equity outcomes. If you have questions during their presentations, please add them to the chat so that they will have an opportunity to respond at the end of the presentation. We will begin with Dr. Bethany Carlos. Dr. Carlos is a pediatrician from Charleston, South Carolina, who completed her medical training at Medical University of South Carolina. She has experience through the American Academy of Pediatrics, MUSC groups on diversity affairs, and international health organizations. She is serving in the National Health Service Corps at a community health facility in Washington, D.C. Dr. Carlos.
Thank you for that introduction, Dr. Williams. Every time I get a chance to just speak about my experience in this fellowship, I always just start by how much of a life changer it was for me. As someone who started this fellowship during the last year of my residency, I think I was the youngest in training of the group. And I was also the youngest in knowing anything about climate change of the group. So this was very much just getting the full breadth of the topic and how much it's impacting the community and the patients that I serve. So, you know, as I go through to just share what I have done and what I have learned through this experience, it very much will show just how in our state of South Carolina, the first goal was to bridge some of the gaps within our state. And so that's what I had opportunity to do. So I think you guys may have slides for me that you can advance to if you have those. Okay. Yes, so while they're pulling up just a little presentation that just kind of gives a depiction of what I chose to use my time in the fellowship to complete when we were all given a task of creating some form of capstone or assignment that we can end our fellowship with. I chose to focus on, like I mentioned, creating partnerships and collaborations within the state of South Carolina. You can go to the next slide. So what I titled it was just a climate change and health virtual conference in South Carolina. And the main goal of this was to create a platform where the different entities and different organizations in South Carolina can learn what each other are doing. As we know with anything in health, nothing can be achieved in silos. And I wanted to make sure that in the small state of South Carolina, we weren't creating silos. So the point of this conference was to have our South Carolina chapter of the Medical Society, which was our South Carolina Healthcare Professionals for Climate Action, to join efforts with our South Carolina chapter of NMA, which was the Palmetto Medical, Dental, and Pharmaceutical Association, so that those two groups can come together to focus on what's happening in South Carolina around climate change, and especially how our more disadvantaged and communities of color were impacted by these changes. To go through this conference was such an enlightening moment because I had a chance to also see what our state was doing, but also some areas of improvement for our state. I'm just so grateful to both of these organizations, the PMDPA and SCHPCA. I think I saw Dr. Haley Gilkey on here, so hi to you. I want to thank them for just giving me the chance to come into both of their organizations as someone who is very new to the topic and just giving me the opportunity to create this space. And I think it has opened a door in South Carolina for these conversations to continue and for it to be something that we can annually highlight the changes in South Carolina. You can go to the next slide. In the next slide, what I show is that beyond that virtual conference, which was held in November, I had the opportunity to also work in different platforms to promote climate change for our pediatric population, including last year's virtual Capitol Hill Day with the Medical Society, having a chance to get op-eds published on nutrition and its impact on climate change. I've been involved with developing chapters for AAP upcoming publications. And furthermore, it has just continued to help me create connections, not just locally, but on state and national levels for different things that we should be thinking about as we move forward in climate change and our pediatric population, especially our vulnerable populations. So I hope to continue to move forward with trying to reinstate in the DC location, which is where I am now located with our American Academy of Pediatrics, to reestablish a committee that can continue to focus on climate change for our pediatric population. So being a part of this fellowship has not at all ended with the graduation in December for me. It is definitely something that has continued to pave open doors and just allowing me to learn more and get more in depth in climate change and health. So I've been very thankful for this opportunity and wish the new class good luck.
Thank you so much, Dr. Carlos. Now we have Dr. Armen Henderson. Dr. Henderson is an internist in Miami, Florida. He is a graduate of Meharry Medical College and completed a residency at Jackson Memorial Hospital. Dr. Henderson is an assistant professor of medicine at the University of Miami and is co-founder of the Dade County Street Response Disaster Relief Team. Dr. Henderson.
Hi, everybody. Again, I spoke a little bit about my project yesterday. And so in the interest of not like repeating information, but still trying to sum it up, I first wanted to say that I was very honored to be a part of the Climate and Health Equity Fellowship along with the other cohort members. I think the thing that really helped me was the amount of information that we gained and the knowledge that we gained from the speakers in the very candid discussions that we had. Before I entered into the fellowship, I actually did start a disaster relief team and noticed the importance of it because in places like Miami and those on the coastal cities along the United States, we experience climate change, whether we like it or not, and we see it every day, not just from the storms and from the hurricanes that seem to brush past our shores every year, but also the other effects, the threat multipliers around the social determinants of health. And so part of my project the capstone project was to create this guide in which we not only respond to vulnerable communities during disaster, but also call out systems that allow communities like the one that I serve in the ability not to be able to be resilient when climate change happens, when climate disasters happen, when flooding happens, and things of that nature as well. So there's one thing that I can say about the guide that I present is that it encourages medical professionals and in particularly physicians to use their platforms, not just in the institutions that they serve on boards on, or that they have jobs with, but actually help give voice to community organizations that are fighting for the social determinants of health, livable wage, housing, access to clean water, and those things, which in turn, if are funded and if people do have access to those things, make them more resilient. And I think that's important, not just in the conversation of this, but also in the context of when you talk about climate change, we can talk about the atmosphere, we can talk about our ability to cut down on fossil fuels and what that does to the environment. But I think if we focus on real problems that individuals face, particularly those that are Black and brown in the communities that are already low resource, I think we can solve a lot more problems together. And so I am very happy to be a part of this cohort. I did share the link to my presentation to the pamphlet that I made of Medical Professionals Abolitionist Guide to Disaster Response, which is my capstone project for the chef program. And I'm looking forward to having it published, but also to sharing the knowledge with people, not just here in Florida, not just here in the United States, but also those around the world who have expressed interest in the project that I put forth. So I'm happy to be here, happy to answer any questions, and also was very fortunate to be a part of this team. So thank you. Kimberly.
Thank you so much, Dr. Henderson. We'll have questions for you at the end of the session.
Great.
And so yes, Dr. Hauser is next, Dr. Stephen Hauser. Dr. Hauser is an anesthesiologist from Greensboro, North Carolina. He is a graduate of Pennsylvania State University College of Medicine. He completed a medicine internship at Christiana Hospital before completing his anesthesia